The general recommendation for meats are to limit consumption during a day and even spread out over a week, aiming for especially less red meat and processed meat. That's the meat that seems to be most closely associated with risk for cancer. The evidence right now is very strong that higher meat intake, especially red meat and processed meat, increases risk for colon cancer and increases the likelihood of death from colon cancer. And especially with processed meats, now some of the guidelines have recommended that we limit those meats or avoid them completely. And processed meats are meats that are processed in a way that they are preserved, either with salting or preservatives added or nitrites. And those meats, we know from animal studies and from seeing how they interact when they're eaten with the intestinal cells, they do seem to have the most cancer-promoting effect. There are healthier sources, including animal foods, that seem to not be so closely related to colon and other cancers. For example, fish seems to have a protective effect. There have been studies showing that more fish in the diet may actually reduce the risk for dying of prostate cancer when someone has prostate cancer. And also we know for cardiovascular disease purposes, it's healthy to eat fish. What's recommended is to aim for twice a week. That's a dose of fish that in observational studies seems to be protective. And for those who would rather not eat fish or want a purely plant-based diet, products like nuts and legumes are also very high in protein, good quality protein as well. And those would include, because they're plant foods, also a lot of these other healthy, biologically active constituents and fiber that we were talking about a little earlier.
We now have very strong evidence that alcohol consumption increases risk of breast cancer, colorectal cancer, upper GI cancers, and some other cancers as well. And what's really striking is that for breast cancer, even one drink or maybe even half a drink a day will increase the risk of breast cancer. And the more the alcohol consumption is, the higher the risk of breast cancer. So keeping alcohol consumption low is definitely an important part of preventing cancer.
Alcohol, interestingly, is protective against heart disease because some of the things that get stimulated might actually help your body manage lipids and cholesterol better, which is why the recommendation for alcohol intake is that people who normally consume alcohol, that they limit to 1 or 2 drinks per day, and not that they have to completely eliminate it from their diet. But at the other hand, there are equal number of concerns with too much alcohol that the recommendations don't say if you don't normally drink alcohol, you should start drinking it. So it's in that category of limiting, similar to red meat. No one says you need to avoid all red meat in order to reduce risk for cancer. It's just limiting and having smaller portions. And that's the message with alcohol when it comes to these recommendations.